Well, good morning, everybody. I'm Don Clavin, Town of Hempstead Supervisor, and I want to thank you for taking the time to join us on our Facebook Live chat. Today, we'll be focusing particularly on mental health. Coronavirus has taken its toll on lives, on businesses, but I think there is a factor a lot of people are not really looking at is the mental health impact this has had on people who have not only lost loved ones, people that are, lost people they work with, and also fears about going back to the workplace. And that's something that we put together a panel to talk about today. Again, I want to thank you. I'm Don Clavin. In the back, for proper social distancing, of course, you'll see no stranger to any of our Facebook Town Live programs ahead of our EMS program here in the town of Hempstead. Dr. Dave Newbert, always good to see you.
Thank you, Brother.
We're also joined by Dr. David Flomenhaft. He's the Director of the Behavioral Health Services at Mercy Medical Center. Doctor, thank you so much for taking time from your schedule.
Thank you.
We're also joined by Dr. Janet Conscalaro, Director of Behavioral Health, Family Medicine, and Internal Medicine at Mount Sinai South Nassau Hospital. Thank you, Doctor, as well. Again, so everybody knows here in the town, we're trying to do everything we can to alleviate the spread of COVID-19. As many of the residents know, we just be opening up the beaches this weekend. There will be limitations on them that include a 50% capacity. We will have additional restrooms set up. We'll have staffing down there to assist you. You have to have a face mask when you show up. You have to prove you're a Nassau County resident. But again, if you go to the town website, we have made the directives. Not only will it have our lifeguards, but we'll also have our coronavirus concierge service to help us.
We have to use the microphone just for some comments.
Get that on there, Casey. There we go. So with that, we did talk about one of the major issues facing so many individuals as they return to what could be normalcy is the mental health aspect and impact they had. So we put together a team to talk to residents, and we're going to try and take some questions along the way. Dr. Scalaro, if we could start with you, if your initial thoughts or anything you'd like to talk to the residents about?
Sure, absolutely. And thank you very much for asking. I appreciate it. We at Mount Sinai South Nassau are very concerned and mindful of the role of family life in our town. Every community, every neighborhood, every village is slightly different, and the diversity is our strength here. However, the road back, the road to recovery, that path is going to be different for every family. So we are interested in helping families figure out what's going to be the right path for them and what they've lost and what they continue to lose, but also what they gain and what they learn from this experience that we've all shared. Mental health professionals and essential workers and families and everyone else. So, yeah.
Thank you. Dr. Flomenhaft?
Janet, I agree with you. This is a family crisis. It's a community crisis. It's an international one as well. And these are times where we need to have some perspective that there's a lot of uncertainty that we're facing right now, and during times of uncertainty, we need to return to routines that keep us healthy and well. One comparison made recently about maintaining your mental health is kind of tantamount to brushing your teeth. You do it twice a day, so be mindful of the things you do to take care of your psychological well-being. For most of us, it's taking a walk. I mean, if you look out your window of your house, you've seen your neighbors bicycling, riding, walking. We're staying in touch with loved ones, all in a perspective of dealing with the immediacy of right now. The past is so remote, most of us can't even remember how long this has been, but I think we're in our 12th or 13th week. We don't know what the future is, but this immediate time is so pressing on us that all we can do is kind of be present and control what we're doing, moment to moment, day to day, and that gives us a sense of kind of safety and well-being.
And of course, as I said, we're joined by our mental health experts, but we're also joined by our head of EMS, Dr. Dave. You're back there. If you have any thoughts you'd like to add in here?
Thanks, Supervisor. I would just say that I agree with everything that you guys are talking about. And we've been talking about it in our coronavirus meetings that this is as much a mental disease as it is a physical one. I think it's very hard for people to conceptualize a virus. You can't see it, you know it's there, it almost feels like an invisible army is coming after you, and I think that we can see the effects of it in the patients that we've been taking care of, and the people that personally I've seen getting sick at the hospital, and a lot of my medical colleagues, and the loved ones that we've seen get sick or lost, and that's it's a very heavy toll that everyone's taken, and I think you kind of have to get through, and when we were in the middle of the biggest part of the crisis, we were just kind of chugging along, but now especially when you have a little time to sit back and reflect, it's gonna be a very different world, like Dave was just saying, that we now have to face, and I think it's very important that we're having all of you guys here and the ability to talk to everybody, because people really need to address that and think about it and be open about it. As medical providers, we almost never say that we're stressed, but the past couple of weeks, I looked brave, and we all have been brave, but we've all had stressful effects from it. We're human, so it's just very important that we all acknowledge that and get the chance to talk to each other. So
I appreciate that. One question in particular that keeps coming up as a case in point. We lost one of our executives here in the town of Hempstead, and one of my council lost her father to coronavirus, and one of the effects was the returning to work, the being comfortable in the process, especially with the new social distancing that's required. We've seen it. We've tried to take precaution here in the town where we've given employees masks, gloves. We have surgical mask gloves. And we've gone to the length of giving them the facial guard. But when it comes to somebody having a fear of just returning to the workplace, what are your thoughts or suggestions or to alleviate that, to make them comfortable? Because that is definitely a hurdle I think everyone's facing.
Yeah, so we often feel that anxiety is a signal. It's a signal of danger. And so we are hardwired physically to react to that by avoiding the danger, running away. Now we have anxiety, as you were saying, Doctor, about an invisible thing. And yet the anxiety is telling us to run away, to freeze, to flight. And we have to help people to understand that anxiety doesn't necessarily signal the same kind of danger as it did 12 or 13 weeks ago, and we need to respond to it and talk back to it differently. And that's the role of behavioral health services.
The timing is interesting. Yesterday I spent a couple hours with an office products company to retrofit our offices for that return to work. Right now we have about a half a dozen folks in an office space in Garden City that usually houses about 50. So would you know that there's a national shortage of plexiglass? Because all those barriers that you've seen in the stores or the banks or the places that you visited, every office that's going to open is going to need that kind of physical separation. So masks will certainly be a part of our future, but so will plexiglass barriers and hand washing stations, keeping distances, using the telephone a lot more for conference calls rather than gathering everybody in a room, as we customarily would do. It's sort of a new order, but there's sort of some opportunities. We found, Janet and I were talking before we got started today, that some of the work from home is going to continue. Actually, a lot of it is. And in some ways, in terms of our business of behavioral health, our productivity has never been better. We've been reaching people that couldn't travel to us before without some transportation glitches, or illness would have kept them at home. So there's some unintended positives that have come out of this that no one would have predicted. So telehealth in particular is something that will continue. But for those people that are coming back into the work environments, we're doing it in a stepwise fashion. We're learning. There's questions being answered. The use of UV boxes to cleanse things that might be shared, for pens and clipboards that you might use for registration. Changing the whole registration process, so there might be sort of electronic acknowledgement of consents, where we used to give somebody a form or an electronic pad to sign. So in some ways technology, but mostly it comes down to just good sense, and when a problem comes up, admitting that we don't always have the right answer, but we're going to work together to figure it out.
Yeah, and I do think that we need to reassure our employees, no matter if they're healthcare workers or grocery workers or any worker, that we are doing the very best we can with the science that we have, and that we are listening to their concerns, and that even if their concerns might seem a bit more extreme than what we are used to hearing, that we're still listening. And I think that helps workers and the workplace adjust to this new normal.
Right. If I might just jump on it, the other thing that I think we have to listen to is that as the intensity of the immediate reaction has faded, and we're into this time when we have a little bit of period of reflection. I mean, going to the beach means people can sit outside their house for the first time comfortably in a long while. That the sense of loss that you identified before is going to intrude in. We lost one of our nurses to this, and we collected a lot of money. We did a lot of sympathy cards. But I think that impact, the realness of that loss is going to kind of dawn on us, and that's where we're going to begin to see this post-traumatic stress reaction. Will it be a disorder? I don't know for sure for everybody, but there'll be this sense of, wow, they're not here anymore. And a lot of people are not here because we couldn't participate in the rituals of going to a wake and going to a traditional funeral. All these things that we've done by extension will now be, as we return to work, there will be empty desks. There will be new people that need to fill the roles that were previously occupied by those that have no longer with us. And it'll be more immediate in the African American family, where there's been so much more loss. So we're really concerned about how to address the despair that's on the underside of this heroism that we're going through right now.
I'm sorry. I just want to say, and I think the other important thing to help people feel comfortable about returning to work from the medical side, not just from the mental health side, is that we can actually take steps to protect ourselves. Like you don't see the army, but the social distancing and and the masks and the hand washing and all this stuff that we've been talking about since the first Facebook Live thing we did. It seems like eons ago, like he said. I think it was a couple weeks ago, so it's like 2 years. But all of those things are ways that people can protect themselves and their family members. So I think just acknowledging the loss, but also identifying ways that you can protect yourself so you feel engaged in your defense, and then that empowers you to feel comfortable that you can return to normal activities. I think that's also really important to listen to to the recommendations of the medical professionals about how to do this in a way that's safe, and understand it is safe, that we will be able to get back to some new normal, but we'll get there. I mean, I think that's important for people to think about.
It's interesting what you're talking about, because we look at it as a combination of, we want to reopen and we want to make all of our workforce just here in the town of Hempstead very, very comfortable. And as I said, we're taking into the account of the inner offices, from the plastic to the mask to the gloves, to dealing with the public. That you have residents coming in, and we're trying to identify with shielding. And we're doing a lot more online. We took our building department online so people could avoid it. And the doc's been wonderful. But I do wonder about something that the both of you touched on, and I saw it very firsthand, was with loss.
Yeah.
When I've lost family members, there was a grieving period. We had ceremonies. We were able to get friends and family together. And something in particular that I've seen is when people have lost loved ones due to this pandemic, they haven't had the ability to have that traditional grieving. They've had a loved one who was in the hospital. They were unable to visit them. They passed. Then they weren't even able to, in one case, bury them for almost 2 to 3 weeks later. And then, again, when that employee came back to the office, her experience was the last time she saw her father before he got this was at this office, was at this facility. And I could sense, the thought pattern of so many issues combining on that individual, and now you take that to so many different levels. How do you sort of account for or walk through the process of someone losing that close friend or that loved one, and then having, not to be able to that true mechanism we're all used to in saying goodbye?
I think that it's important to understand that bereavement and grieving is a process that unfolds over time. Kubler-Ross had these stages. The research on that has not been really solid, but I think what we're struggling with is there's no physical comforting of a mourning person who's outside your immediate family right now. We're not hugging people. who are not in our immediate family. Handshakes, we have these awkward elbow, even the elbow touch has gone away, it's still too close. So there's community-wide grieving of the loss of what we had, the structure of the old reality. And then there's the grieving of the loved one that's not present with us, the coworker. So there are steps that we need to allow to unfold over time. And some people are going to bundle it up and store it inside and not to communicate about it. And other people need to communicate about it. There are people sort of on the front lines in the hospital system that just had to persevere and push through, who pushed it down and pushed it down. And that's some people are going to have ultimately stress reactions where they can't bear to do the same routine before. So we have to help people find a way to express this grief in a way that conveys the social distancing, but also the sense of attachment to one another.
We are offering a virtual bereavement support group, a virtual caregiver group, to try to maintain those ties, to try to maintain that support through this time without having to have people come to a shared location, a gathering. That's not possible right now, and yet still honor the need to begin that process, to share this grief, which is something a little bit different than in the past. As you said, there was no formal ceremony, no shiva. And people are grieving the loss of that too. So it's very complex, and for children, yet another level of complexity.
We're really concerned about kids. Kids
I'm
have
really
lost the
concerned about
structure.
kids.
Yeah. But I think Janet's reference to these virtual groups, they're very important. They're working very well now. We know for AA has continued in a Zoom format. And people have reported good connections. For those people that might have been reluctant to go personally, now they can go virtually. Grieving groups, support groups, Mercy Medical Centers offering family support groups for those people that have loved ones that have a chronic mental illness. The virtual support groups through Good Shepherd Hospice are very important to access, and we'll get you contact numbers to post on the town website. That's the safe way. Talk about the work of grief. The work of grief means showing up and talking with other ones about loss, because we're not alone with this.
And I just add, especially with healthcare workers and EMTs, paramedics, nurses, doctors, PAs, nurse practitioners, all of us have had a completely different role now in our response. I know some of my friends who work in New York City as EMS providers saw a lot of death and a lot of loss, more than they would ever see in maybe years. They saw in days or weeks. And we're all trained as healthcare providers to be the ones providing the care, and it's hard sometimes to admit when we're also emotionally, having to deal with that. So we actually did have a CISD team do a Zoom meeting with our own town's EMS workers to make sure that everyone had a chance to just kind of, get their opportunity to talk about some of the things that they might have seen in their emergency service lives, and to the fact that people couldn't see their family members at the hospital. That fell on a lot of, in a very different way on the healthcare workers and the nurses and the doctors, that we were the ones that were with the family members at the end of their life more, and there wasn't a family structure to help with that, and that's a huge burden also. So I think it's just, we don't often think, we make all the days we're clapping for our healthcare workers, and they are heroes, but heroes don't like to admit when they might need help too. So I think that's just very important, that if you know someone involved in that from all of these perspectives, that you need to reach out and talk with them and check in with them to make sure that they're doing okay.
Janet and I shared a history working with 9/11 families and the uniformed services workers. So some of the lessons learned, that was among the most affected population, because people in the uniformed services are push down those emotions to get through the daily grind, but it takes a toll. And we're very concerned about how long that's going to affect them, what's going to be the impact of substance abuse among the general population, but especially among people that are not trained to speak about the feelings they have about being exposed to abnormal situations that now has become our normal situation.
Yes.
That's right.
It's interesting you talked about children in particular, because I have three little ones, a 12, a 10, and a 7. And since the beginning of the pandemic, I actually have kind of separated from them because I'm in every day. You know, just out of concern, and I regularly go see them on weekends. And that's been part of the process of, you know, when I show up, I'm wearing my mask, I'm wearing my gloves, and my kids, it does take its toll where they're saying, Daddy, are you okay? Do you have it? And there's been this separation, and it is something that I'd like to talk about, how this is really going to be affecting our kids, and the lack of their ability to socialize with their friends and communicate. Simple things that, you know, you almost take it for granted. You have kids that they didn't see their friends for months, and those relationships aren't there, and a simple thing as a birthday. I mean, how do we kind of talk this to our kids? Also, something else we talk about is explaining it to them. Case in point, again, one of the people that we lost here in the town, my kids were very fond of him. They had a special, and I've been very hesitant to kind of talk to them about it because I don't want to get them upset because they like them so much. You know, how do we deal with that part of this?
So I think there's always strength in families. You know, families as a unit are resilient. However, there are families that are suffering tremendously, not just with isolation, but with financial issues, with substance use issues. So as much as we are honoring families during this time, you know, staying tough and staying close, sometimes that's to the peril of children. Those are my first concern. Children that are in homes that are not safe and that are not in school where someone else can keep an eye on them, see how they're doing, check in with them. Our school personnel is trying so hard, but it's tough. The other group of families, more typical families, are feeling the stress of maybe just a little too much togetherness, just a little. And explaining things to children always has to be in a developmentally appropriate way. So you have kids of different developmental ages, and I'm sure your 12-year-old loves to tell your 7-year-old things.
Every day my wife will call me and get them on the conference call, but like, can you explain it to her?
That's right. Yeah. They probably don't want to know. So I think number one is getting our fears in check, getting our anxiety in check, reassuring children that although we don't know everything, unfortunately, I know you're not going to go to camp this summer. And I'm sad about that. And sharing some of that with them. You have the right to be sad. You have the right to be upset. It's not a good situation we're in. And not to minimize it. Oh, it's just 1 year, you'll be back the next. Those are some of the ways we start to develop the resilience in kids that we see just generally. You know, it's telling them the truth, but telling them the truth in ways that they can manage.
Yeah, I would agree. I think as therapists, a lot of what we do is facilitate a conversation. People come into an office with a trained clinician really to find a way to talk with one another. And we hope that they take that lesson that they learn in a sort of a laboratory environment and practice it at home. So we want to give permission for families to talk with their kids and give them a sense of what's going on. You know, tune down the news, put yourself on a media diet, don't overdo it with too much, sensational news information, but have real conversations about loss. I had 2 conversations with teachers yesterday, one of the Freeport schools, and she told me that there are kids they still have not connected with after 3 months of this. Undocumented families who might not have devices and wireless connections. They're not sure how they're doing. So there's concern about the children's loss of the play group, of the structure of the school, all the helpers in the school system. So the families we have to rely on. That's the only support system that we know is effective. But there's a lot of food insecurity, economic insecurity. So as a government, we need to provide those things for them. But we also need to be able to kind of engage them in the conversations about how we're there for one another, and that there is loss, but there's also some dads. Have you seen dads riding in the neighborhood with their kids on the bicycles? They dug the rusty old bicycle out of the garage and they're riding around. These are probably parents that didn't do this before this event happened. So on the plus side, keep it going. Keep playing with them. You know, play with your kids. I'm impressed at the distance you took. I hope that in your limited free time you get to see your kids and have real fun time with them.
Yeah, no, it is striking when I get to them. It is, the family structure is just at a different level where, maybe 4 months ago they were like, hey, we don't want to be with you. Do you come in there? Now it's like, well, let's sit down, let's go outside, let's play catch, and you cherish it. And then on the flip side, I do look at the other stress level that so many of the parents are facing, and they are trying to maintain their career. Because I always say, husbands and wives both work on Long Island. There is no stay-at-home parent anymore. We just can't afford it. So you have these working families that now have been thrust into trying to do their job while also work with the technology of our teachers who are trying to homeschool the kids. And the stress level, I've seen it on so many different levels of individuals trying to manage the full-time career, them trying to make sure, the kids are safe, the kids are taking their classes, and everything else with life.
Just some practical thoughts have come up. Families that have been using the dining room table, the kitchen table, as their shared workstations during these times, after a while, that's not very successful. Kids and parents need separate areas to work. So dust off that desk or that table in the basement and give one of you a shared space, a separate space. It sounds like a simple idea, but it really has made some difference in families. Keep your routine. Get up on time. Keep the routine you had before this event happened. And for those parents that think that they're being heroic in their jobs and answering emails late at night or super early in the morning, you're not doing anybody a favor. The world will still spin even if you don't. Keep your business hours and be present for your family.
The other thing I would add is so many of the commercials are so well-meaning and make staying at home together look fabulous. And if it's not so fabulous for you, that's probably more than normal than what the advertising would tell you is the way to be. So it feels like you're a failure, even being at home. I'm not cleaning the closets. My kids aren't eating fresh baked cookies. Just do the best you can.
And then I would just say, it's hard enough for adults to conceptualize the virus. I mean, a kid especially. So I think it's really important to just, in general terms, explain to them, that they are going to be safe if they wash their hands, that their parents are watching after them. We want to do all the steps we can to make sure they're not going to get sick, and just kind of explaining. Because it's hard to explain social distancing to a young kid, or hand washing, or not touching your face. So I think my parents actually referred me to Sesame Street. Actually had a really good Q&A for kids on coronavirus. It was actually quite entertaining. But it's just important to educate the kids too. Just not talk above their level, but make sure that they have the right information so they also feel like they know what's going on. I think the fear of the unknown affects everyone, and especially children. I think that engaging them in the process is also really important to helping them feel safe at home and safe that their parents are safe.
And engage them in the process of loss. Talk to them about those people that are no longer in their families or in their communities. It gives them information, it gives them power, and it treats them as a mature individual who can begin to discuss what this change means in their lives, and they can put words to the feelings. That's how you give people emotional power, if they can label their emotional state. We as adults need to do that, but it's essential for kids.
Yeah. One question that came up with somebody, it was very, very straightforward, but it's such a question that you kind of hear. He said, how does a coworker deal with something they might not feel comfortable with somebody returning to work that was a survivor of the virus, when there's so much uncertainty if you can get it again? How do you kind of get somebody to that comfort level? How would you kind of want or get that employee to say, all right, I'm happy my coworker's back, but they had the virus. How do you alleviate their fears?
Yeah, that's a complex situation because it impacts both the coworker who is afraid as well as the coworker who has survived. So the first thing I would do is to reassure both of them that in our workplace, whatever workplace that is, we have taken step A, B, and C. Whether it's we have gels, we hand wash, we wear the mask, we're 6 feet apart, and we are doing everything we can to make sure on an ongoing basis that everybody here, not just you and not just you, the survivor, but all of us are safe and all of us can maintain our work and our whatever we're doing to the best way we can. That's number one, is to not make it an individual issue, but to sort of make it, we're all doing the best we can to stay safe. We're all doing our part, and you can do your part too. So some of it is in your control. Make sure you wear your mask. Make sure you wash your hands. Make sure you gel. Make sure you're 6 feet from your coworker. All of those things are in your control. And really making it a workplace issue, not an individual issue.
It's a tricky issue, and Dr. Newberg can certainly be is the expert on the time since the illness and the duration of symptoms and when somebody is cleared for work. If you work in a medical setting, there's probably some employee health that's going to clear you to return to work. But the nature of this illness has been that people have had recurring symptoms. It looked like they have it all over again. And a couple of people have come back to my workplace and have had to go back out for a day to a week. So are they contagious? I think there's a reasonable concern, and we just have to be guided by the science and use all the steps that Janet mentioned that are just basic essentials now.
Yeah, I mean, and as the supervisor knows, and folks that have been in our, been to our Facebook halls before, we've set up a very unique system here in the town of Hempstead to make sure that our workforce stayed safe. From the beginning task force meetings that Councilman D'Esposito and the supervisor had, that we were having, that we actually have set up here in the town a emergency medical operations center for our town workforce, and I'm there every day answering calls and questions from the workforce. And so, from the very beginning, when we first got word that a few of our members were sick, I went out and sat down with the health department and partnered with the health department, and we actually then were calling people and finding them and making sure that people that were sick were staying home and giving them, and we even had trainings for 2 or 3 weeks about, this is how to keep yourself safe, this is how to wash your hands, these are the things. So just like you said, we made it about the workforce, not about the person, and make them understand that it is very important to us. Like, I know it's hard sometimes, and I take phone calls and people are very stressed, and sometimes they just need to talk to me about their concerns, and then I can give them a little bit of the science on the phone, and then they feel better because it answers their questions and they feel more in control. You feel very out of control when you don't know the answers, and things around you seem to be not the way it used to be. So I would say that any workplace should look into similar kind of practices where you have a way for your workers to access medical care, and that you have someone that's there watching over them and a way for them to have their questions answered. Actually, Stu Leonard, the supervisor, and Stu Leonard actually reached out to me, and I did a lot of work for him for his supermarkets and for his stores, where to give educational information, so that way he could empower the workers to, these are the steps that you can take to feel safe at work, and these are the steps to do, and this is how we know when someone can return. And so people just need to understand that there are guidelines in place that we follow, that the medical professionals like me and the folks at the CDC and the health department that are doing this, we follow that every day, and we apply those to protect everybody. So, if it's been 2 weeks, it seems scary, but odds of you getting someone else sick is extremely low. And then, if everyone does the socially right thing by wearing a mask, and that decreases droplets, then got mine here, by the way, just in case you don't think I didn't have a mask with me. That also is a way to empower, to protect the others and protect yourself. So it's definitely, this is a team effort. I think that everyone has to be engaged, from the employer to the employees to the family members. I think everyone working together is really how you're going to get through this and break those barriers that people have that they don't feel comfortable returning.
I think the alternative is the extreme on the other side, that people are so anxious to get to work, so anxious to get back to normal, that they may minimize those steps. And so I think in the workplace you might have a little bit of both, and you have to deal with both.
You touched on before some of the benefits of technology. We're partnering up with the help of Dr. Dave for mental health for the workplace, for our coworkers in the town, and it's something else I know others are exploring. But it is nice that there's the ability now that you can go online and go and talk to a professional. Talk about a benefit and use of technology for that kind of resource. What are some avenues if somebody's just watching and they're saying, well, I don't work for the town and I don't have that resource. Are there, professionals they could reach out to at each of your facilities to talk to on a regular basis?
Yes, we are completely in a telehealth mode now, so it's not that sophisticated. We're just using the telephone, but Catholic Health Services is using TeleDoc, which is a more sophisticated platform that has video component to it. So what they call it CHS e-visit. So most insurance companies are encouraging that. I mean, all have supported this transition to telehealth, and we think it was here before, and now it's really going to stay because it's got wonderful benefits. So that should be available throughout Catholic Health Services, and most medical providers are going that direction.
Yes, and at the Mount Sinai Health System, indeed, all visits are potentially telehealth visits. We do use a secure system of video as well as audio. We do have a 24-hour hotline for any community member that has a concern, has a question, has a child with a concern or a question. They can call our number, and a therapist, a licensed behavioral health therapist, will answer their call 24 hours a day.
That's amazing. At the end of the program, we'll put up on the town website both your facilities, the contact information, because there's such a great need for it. Here's one question that
Supervisor.
Yes,
I was just gonna, I'm sorry.
No, please.
The supervisor reached out to me about 2 weeks ago when we initially started talking about the mental health piece, and we are very mindful that our workers are strong and have been brave and have done very, very amazing things to get all of us through this to now, but we want to make sure that they have access to the facilities and the resources that you guys are here. So I reached out to both you guys when he asked me, and I'm just very happy that you guys are here, and we really appreciate that, not just for the community, but for our workers, that you guys are available. And anyone that calls our operations line that needs to talk, obviously I'm there, but it's very nice having these resources, and we're very happy that the town can partner with you guys, and we appreciate what you're doing on behalf of our workers. So.
We have, we have great, amazing facilities, right here, Rockville Center and Baldwin, and Oceanside, I should say, and it's great that everyone's teaming up. Here's one unique question. Does it get to a point, do we get to a level where we can commemorate these people, these thousands of people we've lost because of coronavirus? Do we get to a point where we can take a day or have some sort of ceremony to remember and recognize all these losses?
Don, the question begs the issue of, and before all this, we wouldn't have really even asked that question. We had a format for all of this. There were very established rituals around funerals and wakes and shivas and every other ceremony that our religious perspectives offer us around saying goodbye to somebody. And all those rituals have to be revisited. It's as if we've been fractured from those, and we're doing these Zoom funerals and wakes, and boy, it's just not the same. So that's part of our loss, is that we can't do it as it was. So we lost this coworker I mentioned. I thought we did something nice. We collected reminiscence from everybody on staff. Our arts therapist put it in a book, made it very pretty, and we mailed it to the family. Those people that can go to the ceremony, in the limited access that they have, will go. But we've seen the birthdays, the birthday caravans. And for the funerals, how do we send cards, of course, phone calls? Let's not forget telephone calls. They're so essential. Call the people that you're concerned about. Stay in touch with them. Everyone appreciates that contact. We're going to kind of figure it out the best we can as time goes forward.
Well, I agree. We're making this up as we go along. And it does take some time. And as David said, we worked together very closely for years around 9/11 and thereafter. And it does take some time to figure out, what does this mean to us? And when we get there, we'll know what to do.
It's interesting that both of you touched on it so well. We've had such the town of Hempstead is the only township with cemetery. We'd average anywhere from 3 to 5 a day. We were at capacity where they were averaging 20 to 25 a day. But then you'd say the guidelines were only 10 individuals could pay their respects at the grave, and they had to be allotted a certain amount of time. And I do say that the loss and the limitation of saying goodbye to that loved one, people are going to want to come back, to pay those respects for that ceremony, and they're going to relive this loss in such a way. I don't know if I've ever seen how it's going to go, take place all over again, that loss, when they're finally able to go graveside with maybe more than 10 people and say, let's do another ceremony. It's really, almost a redo of it, and that's going to have its toll on people and the families.
I will share, I did have a loss during this time, and the belongings of the person are still in a home that I can't go to. So yeah, I do anticipate, even for myself, I have to relive this. And yeah, absolutely. It's not just me. I know it's thousands of people.
Yeah, I would just say, do what you can that's under your control right now. Make phone calls, send condolence cards. We learned from 9/11 that there were ceremonies that go on every year to this day. We built a fantastic memorial in downtown Manhattan. Many communities have memorials as this town of Hempstead does. So some of those rituals will be figured out later on. But in the immediate, step up and do what's within your means. And that will give you a sense of acknowledging the loss and being present for those people that you care about.
Yeah.
I want to thank all of you for taking the time for this panel. I'm probably going to ask you to do it again. I thought it was incredibly insightful. And you know what? You could see from some of the questions we received, the angst that some have, the concern, and it's great. I told all the residents that we will be putting up on the town website all the information for the services these providers are giving out there to help everybody with their mental health questions. Before we close, I'm going to ask everybody, give everybody a shot. Doctor, I'll start with you. And this is great. I can just simply say doctor. Doctor, I'll start with you in the back.
Just look out for each other, continue to do everything to support your friends and families and your colleagues, and just know that there are medical professionals out there working very hard to get us back to a new normal. And just, I know it's hard, and we probably all have quarantine fatigue now, and but we maintaining the steps of social distancing and wearing masks and things that I know are very uncomfortable and different, and it just messes completely with the way we socialize with each other. And we're social people, humans. It's hard, but just know that by doing those things, you're helping each other, and you should continue to do everything you can to help each other. And just know that we'll continue getting the information. We have great people that we're working with, and you all take care and hopefully enjoy your Memorial Day weekend. Maybe it's nice out right now. We can get a little chance to get a little breather, and just be vigilant, but also be brave, be strong, and take care of each other.
Doctor?
I couldn't have said it better. You said it all. Give yourself some grace. And do the best you can, and do have some moments of joy.
Doctor?
Love who you're with. Give them a hug. I'm sure they could use it. And cultivate joy. Look for positivity in your environment. The negativity you don't need to be reminded of, but cue your attention to those things that are inspiring and give you some sense of awe. And that way you perhaps can share that with others.
Well, I want to thank you again, and I do want to wish everybody a happy and a safe Memorial Day. I want to remind residents, beaches are open. Governor's rules limited to 50%. They're open tomorrow morning. You can go on down. We'll have lifeguards. We'll have what we're calling our rec staff coronavirus concierge that will guide you with any assistance you may need, with hand sanitizer stations. Of course, with lotion, suntan lotion, directly to the bathrooms. They'll have pamphlets, which will give you the safe protocols that are needed. And I just ask residents, I understand, and I read them all the time, everybody would like everything to be open. A lot of this is based on the restrictions we're receiving from the governor's office. And I ask everybody, to be mindful of that. It's not that we don't want to open up the parks or we don't want to open up the cabanas. We'd like to, but these are the rules that are set forth by the governor. And we are following them, and they change almost daily, and if things can be opened up quicker, of course we will. So I ask everybody to work with us, work with our staff, and just be mindful of that when you're at the facilities. Everyone's trying to do the best they can. So with that, I want to say thank you to all of our professionals. I wish all of you to be safe, and we'll get the information up from the providers of how you can reach out in case you need help. Thank you again.